Knock, knock, knock.
Come in.
Hello, Miss Pinkern. How are you doing today?
Good, how are you doing?
Good. My name's Rachel, and I'm going to be your nurse this afternoon, and together we're going to go through the important aspects of living with type 2 diabetes. How does that sound?
Well, I was wondering how diabetes was going to change my life.
All right. Well, would you like to follow me into the next room, and we'll start the teaching process?
Sure.
First, I'm going to teach you the importance of nutrition, what to eat, when to eat, and how much to eat. Then I will teach you how your diet affects your blood sugar. Lastly, I will show you how to correctly test your blood sugar and how important it is to record your results on a regular basis. How does that sound?
Sounds good to me.
So, what's your diet like on a regular daily basis?
Well, in the morning on my way to work, I stop by the gas station and pick up a donut and a large coffee with extra cream and extra sugar. And then for lunch, I try to stay healthy, and I get a salad usually with extra crispy chicken and extra ranch and a soda. And then for my snack on the way home, I drive by McDonald's and get their 49-cent ice cream cone. What a deal! And then for dinner, at least once a week, I bake lasagna for my family because it takes the blue ribbon every year at the county fair. And I wind down the night with a glass or two of wine and watch Grey's Anatomy.
Well, congratulations on that blue ribbon. That all sounds very nice, but I think we're going to have to make just a few adjustments to make your diet healthier and more beneficial for your new lifestyle.
Oh man, I had a feeling you'd say something like that.
Well, I'm not telling you that you can't eat these things. They're only good in moderation. Portion control is one of the most important concepts when understanding trying to maintain a well-balanced diet dealing with type 2 diabetes. To help gain a better understanding of portion control, let's take a look at this portion control plate to get a better idea of correct portions of each food. As you can see here, on half your plate, you want to have non-starchy vegetables. And then on the other plate, it's split into twos with meat or other proteins like chicken or eggs, and then starchy foods on the other half here, the half of the plate, which could be pretzels, bread, corn, or pasta. Up here in the corner, we like to choose a beverage, milk preferably, and one simple change that you can make to your diet is going from 2% to 1% or skim. If you choose milk as your beverage, choose a fruit to put here. If you choose a fruit juice beverage, you may choose to add a dairy or other carb here, such as yogurt or cheese. Now how about let's take another look at this plate here, now that we have a better understanding of what fruit groups we should take and put onto our plate. Would you like to show me a meal you would put together here?
Well, you said a glass of milk would be good, so
yes,
maybe I'll put that
there. That is a great choice.
And then I'll put the apple here. And then, oh, this cheeseburger looks good. Let's put that over there. Starch, potatoes, yum. And then a cookie for dessert. How's that look?
Well, the glass of milk, the apple, and the potato are pretty good choices, but how about you think over again about this cheeseburger and cookie?
Oh man, well, I guess I could have some of this delicious looking chicken.
That's a better choice.
With my potatoes, with some green beans, yummy, and some carrots. Is that
lots
better?
of vegetables. Yes, that looks perfect. Okay, now we're going to go over how to test your blood sugar and the importance of monitoring it. Any questions before we get started?
None that I can think of at the moment.
Okay, well if you have any questions at any time during my demonstration, just ask me to stop and I can better explain it for you. Okay, let's get started. First, before you want to test yourself, you want to wash your hands, but in this case we're going to use hand sanitizer today, and make sure they're completely dry before you test yourself. You should always make sure you have everything in your kit. You want to have your meter, your testing strips to put in your meter, your lancing device, your lancet, and an alcohol swab. And you always want to make sure you have your journal with so you can record your results every time you test yourself. Alright, so first we're going to want to get our meter ready. And you'll take one of your test strips here, and then you're going to insert it into the meter. It will turn on. Don't apply the blood until it says ready. We'll set those aside. This is your lancing device. I'm going to take off the cap here. You're going to insert the lancet in here. I'm just going to twist it, make sure it's in there. And then I'm not going to pull it off, but you'll pull off the top. You'll pull back the lancing device, and then you can set it to different strength. You want to make sure that you wipe your finger off before you use your lancing device to prick you. And you want to make sure it's completely dry, because the alcohol can sometimes mess up the meter. Then you want to prick the side of your finger, and you want to alternate different fingers because sometimes it can get tender, sore, or calloused. And then you're going to have to squeeze a little bit to make sure you can get the blood out. Make sure there's like a little dot. And then you'll touch it against your meter, and then it'll wait a few seconds, and then it will tell you what your result is. And your target range should be between 70 to 130 before a meal, and then after a meal it should be greater than 180. Does that all make sense?
I think so.
Now how about you give it a try?
Okay, so first I'm going to wash my hands, or in this case, use hand sanitizer.
Always keep a little one from Bath & Body Works that I like in your purse.
Oh,
If there's
those
not a
smell
nearby
nice.
sink. Nice handy dandy.
From
They even got those
restaurants.
cute little straps that you can put on your purse.
That's a great idea.
Yes.
So then I take a testing strip out and just insert it into the meter.
Yep, just like that.
Yep.
Yep, and you'll see the little blinking blood drop. That means it's
Okay.
ready to go.
And then I'll take my cap off and insert the needle.
There we go. When you put on the cap, make sure you don't bend the needle. There we go.
I think we're good. Take out my swipe and
Make sure it's completely dry.
otherwise it'll mess up my results.
Yes.
I was listening.
Good, good.
This.
Load it. Yeah, you might want to set it down maybe on a lower
Like a
level,
3
like
or
a
4?
3.
3. Okay.
Did you got it loaded?
Yep.
Side of your finger. Did you feel it?
Yep.
Give it a little squeeze. Sometimes it's nice to go from the bottom of your finger, the whole finger, and push it right on up. There we go. That should be good.
And just
Apply it to the tip. And it should take about 5 seconds there. Okay, at 153. Now, we know that your target's around 70 and 130, so it's a little bit on the high side, but with adjusting your diet, like that I showed you earlier, I think you'll be on a better track and you'll hit your target goal.
good. I'll make sure to record that in my journal.
So, do you have any other questions?
No, thank you. This is really helpful.
Okay, we just have to go over one last thing. I just want to emphasize the importance of keeping a good record of your glucose results. This is important for many reasons, such as getting familiar with your normal levels at different times of the day. Also, it may help you to see how different foods, activities, and stress can affect your levels. Keep in mind that your blood sugar level can trigger strong emotions such as being upset, being confused, anxious, or frustrated. So if you keep a record, you know when you start feeling these ways and when your blood sugar levels may be high or low. I know this is a lot of information to take in, but this is going to be your new normal. It will just take a little time and a little patience to get used to.
Yeah, it is really overwhelming, but I have my family behind me to help make this transition easy.
Well, good. Here are some pamphlets to help guide you, serve as an extra reminder throughout your process. Here's like the food groups and different brochures. And I just want you to know that never hesitate to call the clinic or even ask for me. We're here to help.
Okay, thank you so much. You've been such a great help. I'll be sure to call if I need anything.
All right, good. Well, I hope you have a good rest of your day.
You too. Thank you.